Good morning. My name is Maaks. I am a nurse care manager, one of 12 within the St. Louis Physician Organization. We work with patients who have multiple chronic diseases and help coordinate care with their primary care physician and specialist. With this collaboration, we help to remove compliance barriers and close care gaps. Each of us care managers has success stories to share. Most of the successes entail measurable means. The story I would like to share is not about the number of pounds lost or how much better the blood sugars have been. It is a partial testimony from a patient who measures his success by how he feels. In his own words, here is his story. Before having a care manager, I was emotionally lost, in the sense that I felt unable to speak to anyone about my illness aside from my wife, and the trouble I had about what to say or ask from my doctors. I felt lost beyond reach, mental and physical pain, very poor quality of life. I had been hospitalized many times over the last 2 years for mental illness symptoms. Then I worked with and got help from Maaks, nurse care manager with SSM. As a result, I have scheduled appointments with her that help me be more responsible and have a purpose, and also to be able to maintain a routine, which is extremely important for not only my mental illness, but for my diabetes as well. I keep a notebook of not only the foods I eat and my blood sugars, but my thoughts and other issues. We go over these at each visit, and even if we don't discuss them, it has taught me a way to release pent-up or confused thoughts. And now I feel I am at a point of a remission, or the beginning stages of functioning somewhat normal. Monica helps me feel a little better at a time and helps me when I need it. She speaks to me at a level that I can understand and communicate back with her. She knows what, how, and when to say things to me. She helps me to communicate with other doctors. I have a very hard time talking and understanding things, and she is always helpful with these issues. Sometimes she helps me by pointing out alternative views that I don't think of. Being able to have the opportunity to see Monica regularly has helped to keep me out of hospitals, because without this type of training, coaching, communication, I would continue to spiral downward. This program is different from attending office visits with a psychologist because it has less of a time constraint, and Monica spends time with me as my needs require. It is very individualized. It has helped me build confidence in myself. His wife added, "Diabetes and mental illness are ongoing issues until death. And though a person may do well for a short while, there is always a need for this type of program and education. Monica's skills and coordination have proved tremendous for our family." I'm proud to share this testimonial with you. It reassured any doubts I may have had and made me realize that I am making a difference in his life. He continues to be one of my more challenging cases, yet he is my most rewarding. The reality is that there are other patients just like him. With time, patience, understanding, and the coordination of care, we can make a difference. Thank you.